So for the joint injury research assignment, I was assigned the shoulder separation. So starting things off, what is a shoulder separation? A shoulder separation usually refers to an AC joint injury. This stands for an acromioclavicular joint injury. These injuries occur when the two parts that make up the shoulder are partially or completely separated from one another. These two parts are the collarbone and the end of the shoulder blade, scientifically known as the clavicle and the acromion respectively. These bones are held together by the acromioclavicular joint and by extension, the acromioclavicular and the coroclavicular ligaments, often referred to as the AC and CC ligaments. When an injury occurs that causes these ligaments to stretch or tear, they can cause damage to the joint, which causes the shoulder and its two parts to become separated to an extent. So in the image included, you can see the AC ligament and the CC ligament attaching to clavicle and acromion. By seeing this visually, you can sort of see how these ligaments tearing or stretching could cause the clavicle and the acromion to come apart, resulting in the overall shoulder separation. The most common cause of the separated shoulder is falling directly on the shoulder or taking a blow to the shoulder. The injury can stretch or tear the ligaments that hold the collarbone and shoulder blade together. As a result, those who play sports in which they are highly susceptible to bodily contact or falling are often at a higher risk of shoulder separations. This can include sports like football, hockey, or even activities like skiing, gymnastics, and volleyball. Here I'll show you a clip of the type of high-impact accident that has to happen for the injury to occur. So the injury the biker sustained here was exactly what we're talking about, a shoulder separation. When you slow the clip down like this, you can begin to picture already in your head just exactly how this could cause a shoulder separation. A high-impact fall like this could easily tear the ligaments that make up the joint and could cause the shoulder to separate to a varying degree. These degrees, to be exact, consist of type 1, type 2, type 3, and types 4 through 6. Going into specifics, a type 1 shoulder separation is when the AC ligament is partially separated but the CC ligament stays intact. In this type, there is injury to the ligaments but no severe tearing or fracture, so it's more commonly referred to as a sprain. Type 2 gets slightly more serious as the AC ligament is completely torn but the CC is not torn or partially torn. When this is the case, the collarbone will be partially separated from the acromion. Type 3 is when both the AC and CC ligaments are completely torn and the collarbone and acromion are completely separated from one another. The three more classifications, type 4 through 6, are very uncommon and include the tearing of the deltoid muscle and trapezius muscles, but that's a little bit more specific than we need to get for this particular assignment, so we'll just leave it at that. As for the symptoms one might feel after sustaining an AC joint injury, they often include shoulder pain upon injury, shoulder or arm weakness, limited shoulder movement due to pain, bruising or swelling at the top of the shoulder, and also possible deformity. In these two images, you can get a visual idea of just exactly what the symptoms look like. So on the left, you can see deformity. There's a small point at the top of the shoulder that doesn't look natural and often indicates a shoulder separation. While on the right, you can see the bruising as it causes a purplish discoloration upon the shoulder, which is often a red flag. Depending on the severity of the separation, there are multiple ways a shoulder separation can be treated, many of which do not necessitate surgery. Type 1 or 2 injuries can be supported in a sling until the discomfort decreases. Over-the-counter anti-inflammatory drugs such as acetaminophen, ibuprofen, and naproxen sodium are also given in order to ease the pain. Type 3 shoulder separations may also get this type of non-surgical treatment. However, many experts disagree on what is the best way to treat it, so depending on doctor to doctor, this can vary. Since recovery from a shoulder separation is, for the most part, non-surgical, most of the recovery is in the hands of the athlete themselves. So usually they want to rest because avoiding of activities that aggravate shoulder pain can help give the ligaments time to recover. Movements in which the shoulder cross in front of the body can be especially dangerous for those suffering shoulder separation to perform. So that's why a sling is often given to prevent movements like these from accidentally occurring. Ice can also help reduce shoulder pain or swelling, and physical therapy is often done after a few weeks in order to help restore strength and motion in the shoulder. The physiotherapy usually starts a few days or a week after the recovery process has occurred, and it's in order to strengthen the shoulder, like I said, and regain range of motion. It also prevents a condition known as frozen shoulder from occurring. Furthermore, it can prevent arthritis from developing in the shoulder. The physiotherapy sessions in order to help the shoulder recover can include neck rotations, shoulder rolls, neck stretches, shoulder blade squeezes, shoulder flexion while laying down, shoulder extension while standing, and goalpost stretches. These exercises are specifically targeted at recovering patients regaining mobility without being too intensive. As you can see from these examples, they're rather easy on the shoulder to perform, but also do help with slowly introducing movement back into the pretty inactive shoulder. While it's rare for a shoulder separation to require surgery, type 4 through 6 may require surgical treatment. If this is the case, a surgery to reconnect the ligaments or injured bones can be proceeded with. This is usually done with surgical screws being put into the clavicle and acromion. Thank you for listening to this brief summary of the shoulder separation joint injury. Thank you.